My name is Paul Warwick, and I'm a volunteer with Michigan Healthcare for All Northern Michigan. Our group is part of the Michigan for Single Payer Healthcare organization, and we work primarily in Chippewa, Mackinaw, Sheboygan, and Emmett counties. And beyond our 4-county region, we also have people in our group who are in other counties of northern Michigan. They connected with us because they too are interested in starting up movements in their local communities for single-payer health care. We are pleased that they are part of our group, and we pledge to do whatever we can to help one another out in the cause. We are honored that Center for Change, a Northern Michigan advocacy group, is co-sponsoring this event. In fact, it was the Center for Change who came up with the idea of forming our Healthcare for All Northern Michigan group in order that we could work with the Michigan for Single Payer Healthcare organization in our region. We now consider ourselves to be a subgroup of the Michigan for Single Payer Healthcare. We publish our news and announcements on Michigan for Single Payer Healthcare's public Facebook page, as well as on the Center for Change's public Facebook page. The Center for Change's primary purpose is to support local citizens who are working to bring about progressive change in their communities. You can find more information about the Center for Change by visiting their Facebook page. Simply type in the Facebook search window at Northern Michigan Advocacy, and that will take you to their page. The full name again is Center for Change, a Northern Michigan advocacy group. We have invited Eli Rubin to be our guest speaker today. Eli received his bachelor's from Swarthmore College in Pennsylvania in 1997. He received his master's at the University of Wisconsin in 2000. And in 2004, he obtained his PhD in history at the University of Wisconsin-Madison. Dr. Rubin is currently a professor of history at Western Michigan University. He specializes in German history during the period of World War II, as well as post-war, going into the modern era. He teaches at both the undergraduate and postgraduate levels. Evidently, history isn't enough to occupy Eli Rubin's mind full-time. In addition to his university position, Eli is very active in progressive organizations and causes. He was part of the organization Michigan United, which eventually launched Michigan for Single Payer Healthcare. Eli is not only the co-founder of Michigan for Single Payer Healthcare, he currently serves as its president. I encourage everyone to look up the Facebook page for Michigan for Single Payer Healthcare. You can find it by typing in the Facebook search window, all caps, at M4SPH, for the number 4. Their website is www.michiganforsinglepayer.org. Eli regularly spearheads lobbying efforts on behalf of single-payer healthcare. He also delivers presentations across Michigan to help educate the public about the single-payer system. Increasing numbers of Americans are realizing that our current for-profit system is broken and approaching a total collapse. Eli is here to inform us how single-payer healthcare will provide us all with a far better system. Please welcome Eli Rubin.
Oh, thank you. Just wake up the computer so we can get it on the screen. Thank you. So thank you, Paul, for organizing this and for inviting me. Thanks, guys, for coming. I know it's a beautiful day. I know there's a lot of tourists out. I know the Women's World Cup is going on. So, I wanted to just start by saying that, this presentation has a lot of information in it. Okay, it's going to be a lot. My feeling is better too much than not enough. And you can download this PowerPoint from our website and from our Facebook page, and you can use it for your own reference. It has citations that lead you to all the right studies, all the right sources, which are useful sometimes in online discussions, but also you can use it and give your own presentation. It's got everything you need. And then we'll have time for questions and answers, anything that doesn't come up. There's also handouts in the back that have a lot of information on them as well. And I should say that, I got involved with this in part going way back, as Paul said, I focus on German history, so I had the opportunity to live in Germany, which actually is not a complete single payer system. I think we could do better even in the German system, but for all intents and purposes, it is. It is a universal healthcare system that's very close to single payer. And my second child was born there. My wife at the time, she was an EU citizen, so of Ireland actually, but in the EU it doesn't matter which country you're in. So we got to live in Germany as though we were German citizens, part of the healthcare system. And, we were able to go anywhere we wanted for healthcare. In contrast to the myth that there's all these waiting lines, there were no waiting lines because we could go anywhere we wanted. We were in a big city in Berlin, but, still, we could choose any place to have our kid that we wanted to. My wife chose a midwife clinic. They call it in German Geburtshaus. It means it's just an apartment with midwives and all naturopathic, no Western medicine, no epidurals, nothing, just acupuncture and aromatherapy. And this was not, it turns out, the best choice for giving birth. But I didn't have to go through it, so it was my wife who had to go through it. But the point is that we could choose, and in the end, we had a bill for about $30. That's all we had to pay. And midwives come every single day to check on mom and baby, and it was just an incredible experience. And then a little bit later, when we needed a pediatrician, we just picked the guy down the block because we were Americans in Germany and we didn't know where to go. And he was not very good. He was not very nice. He didn't speak English. Our German was rusty, so we just didn't go to him again. We just went to the one a little bit further down the street, and she was great. She spoke English, and she was our pediatrician while we were in Germany. Again, the point is, we just had a card that's the German, healthcare card, and we just went around to whatever doctor we wanted until we found the one we liked. There's no calling insurance company saying, is this person in the network? There's no surprise bills where, one midwife was in the network, but the other one who came for half an hour wasn't, so you're going to get billed, $8,000 for her. None of that. The Germans don't even understand that. You just go, you swipe your card, and then you focus on having your baby and getting your baby healthy. That was it. So that was my experience, and I, come here, and it's really a shame that people don't even realize that's what it's like for most people in the rest of the world, not just Germany. It's like that in Sweden, it's like that in Israel, it's like that in Canada. And it really makes you wonder why it isn't like that here. And people have known about this for a long time. Martin Luther King was very much aware of this. Had he lived, he probably would have gotten around to organizing an enormous march on Washington for universal health care, because he was very concerned about it even back then. And the reason he said this quote, that injustice in healthcare is the most shocking and inhumane of all the forms of injustice he encountered, is that it's for our very lives. There are all kinds of very unjust things that go on. People's property, people's rights, people's freedom get taken away. But when people are forced to pay hundreds of thousands of dollars that they can't afford, they die. That's your actual life and death. So our organization is basically organized around a vision. And the vision is, one day we're going to have a country, in this country, the United States, in which it doesn't matter how rich or how poor you are. You're sick, you go to the doctor, you get help. You get medicine, you need, throw your back out, you go to a chiropractor. You feel a lump, you go to a hospital. Your kid has a fever that won't break, you take him to the ER, take him to the pediatrician, and all you got to think about is getting better. You don't have to think about how much is this going to cost me. It's just your right to be healthy. So let's go dig a little bit deeper into the problem. really look at the numbers because it's pretty shocking. Okay, first of all, we spend way more on healthcare than other countries. The only country, and this is by percentage of GDP, because some of these countries are much, much smaller than us. We spend way more, twice as much as most other countries. France and Switzerland are a little bit higher, but the average, that's OECD, that means the average of like industrialized countries, we spend twice as much as the average country. Before that, we have some of the worst statistics of any industrialized country. Our life expectancy is lower to significantly lower than all our peer countries, Canada, UK, Germany, Sweden. Some of these are really bad. Infant mortality is on the level of a third world country. Sweden is 2.5. We're more than twice that. Maternal mortality is down with, like Nepal and Tanzania. Okay. And this statistic gets even worse if you just isolate it for women of color, especially African American women. Now it's like double even that, right? Because you add racism into the system as well as poor healthcare and inability to pay. Remember, I said that in Germany, it wasn't just that the midwives took care of everything and it was all paid for. It was that then the system also paid for a midwife to come to our apartment once a day for, I think it was 2 weeks or maybe 10 days to check on mom and baby, and then thereafter every week for something like, I forget what it was, 4 weeks or 5 weeks, just to make sure there wasn't anything going on. So you can actually chart this where you look at how much we spend versus how bad our statistics are, right? So like higher healthcare system performance, lower healthcare system performance, lower spending, higher spending. Because one of the things people might say is like, well, those countries spend a lot. That's not really true. They spend less, but they have much better statistics than us, especially these ones here. We are an outlier. We spend way more, and our statistics are really bad. And of course, as you probably already know, there's no other country like us that doesn't have your universal health care. Every industrialized country, and many countries that we would say are not industrialized, right? Bolivia just became the latest country to guarantee universal health care to all people. A couple of years ago, Nepal was the latest to guarantee health care. So we're not falling behind Bolivia and Nepal. And you can see here there's a few other countries like in Syria, Afghanistan, Chad, and then the United States. That's the company we're keeping. And we'll talk a little bit about it. Not every country has the same exact system. There's different models. That's what makes it particularly galling when politicians that we talk to say, well, how could we ever do it? How will it? I mean, we have a whole menu of choices. There's the way the Canadians do it. There's the way the Australians do it. There's the way the Israelis do it, the way the Japanese do it, the way the Germans do it, the British, the Swedish, the French, the Swiss. They all have their own models. The Dutch have an interesting model. So there's plenty to choose from. So look, we passed the ACA. And at the time, there were 70 million people with no insurance. We got 40 million people insured. That was good. That was very good. We saved untold numbers of lives. But it didn't go far enough. There's still 30 million people who don't have insurance in this country. 45,000 people a year die because of lack of insurance. And that's, unfortunately, that number hasn't changed since Obamacare was passed. That was the number in 2010. It's still the number. But probably a bigger problem even than this is that there's 41 million Americans who are what we call underinsured. Underinsured means they have technically insurance. They pay premiums. They have a policy. But the deductibles, the copays are so expensive, they really can't afford to use it unless we're talking about triple bypass open heart emergency surgery. I mean, if it's just going to the ER for a sprained ankle or a broken, wrist or something like that, they can't afford it. And that's, again, because of the deductibles, right? The deductibles are the amount, as you guys know, that you have to pay before your insurance kicks in. The idea of deductibles came about in the 1930s because of a mistaken premise that if people don't have quote-unquote skin in the game, meaning if they don't pay a little bit too, then they'll overuse the system. That's a fallacy, because how many people do you guys know who love going to the ER, who just love having tests done at the doctor's office? I know of 0 people who just sit there and think, I can't wait till my next throat culture.
Yay, they colonoscopy.
Yay, colonoscopy. Ooh, I can't wait to get my daily mammogram.
Yep. Yeah.
No, that's not true. It might be true if we were talking about trips to, Cedar Point or something, but that's not what this is. And then what it became was a way for insurance companies to make money by not having to pay. The average deductible has gone up 212% since 2008. These are wages. This is inflation. And these are deductibles. It's worse when you realize that, according to the U.S. government, 40% of Americans do not have $400 to their name to pay for an unexpected expense. And that's not just health. That's the car breaks down, right? You get in trouble with the law, get a fine in court. They don't have it. They really don't have it, unless they're going to be begging neighbors or friends for the money. 61% of Americans don't have $1,000 to pay if they get an unexpected medical bill, and that's most people's deductible, if not higher. So what that means is, and again, these are a lot of facts and figures, but hopefully you can kind of get a sense of the story that these facts and figures are telling you. It's really bad, right? Premiums, which is what you pay each month to have the right to pay again in a deductible, have gone up now every year substantially. You can see this is what employers pay, is the light blue, and what employees pay for people who have employer-sponsored insurance. So employers are, paying more than employees, but it's still really bad for businesses, as we'll talk about. And you can see here in comparison to wages, right? It's been a little bit better the last 6 years, primarily due to Obamacare, but it's still, premiums have still gone up more than wages have gone up. So average workers are still really falling behind. The median income in Michigan is $55,000, right? Just to give you a sense of that. And as you can imagine, people are going bankrupt. 67%, 2/3 of all bankruptcies are due to medical bills. That's about 1 million Americans a year become bankrupt just because of medical bills. 25% of all Americans, 1/4 of all Americans, struggle to pay their medical bills, including 1/5 of everyone who has insurance. And again, this doesn't happen in any other country. You go to Germany and you meet somebody and they tell you a story about how they had to have an emergency appendectomy, or they messed up their knee skiing in the Alps or something like that, and were rushed to an emergency room. And as an American, you're thinking, oh my God, that must have just completely wiped you out financially. And they say, what? No. Why would it wipe me out financially? It was very painful, and I had to, I didn't like the doctor, and he, whatever, but wipe me out financially? What are you talking about? No, I had to get, knee surgery because of my skiing accident. One of the worst things is cancer. Almost half of everyone diagnosed with cancer in this country loses everything within 2 years of their diagnosis, because the insurance just doesn't cover what they need for their treatment to survive. They lose all their savings, their business, their house, their kids' college funds. They have to drain it all. The single largest category on GoFundMe, the fundraising site, is medical debt. The founder and the CEO of GoFundMe recently came out and said we need single-payer healthcare or something like it, because GoFundMe was never intended to be an alternative health insurance system. It was supposed to be for fundraisers, for charity events, stuff like that. And you can see this guy. He was a diabetic whose insurance didn't cover his insulin, which cost $750 a month. So he relied on GoFundMe to live. And this is a screenshot of a month that was a good month for him. This guy named Shane Boyle. I lived in Arkansas. But he wasn't able to keep up with it, and he died. He went into a diabetic coma and died. And part of the problem is health insurance companies, okay? Oops, let me go back a second. Part of the problem is health insurance companies. So an average health insurance company denies 20% of all claims. They set that quota, right? They just say, you know, every fifth claim that comes in, send it back to the doctor, stamp it denied. Or to the patient if they're trying to get reimbursement for themselves. You talk to people who work for insurance companies, they'll say, well, that's because there's fraud. Those doctors are fraudulent. They're submitting stuff for patients they never saw, or patients are saying that they broke their toe and they just scratched it and they want $10,000 for, you know, they're just milking us. Go after them. We're not the bad guys. But the truth is that 60 to 80% of these are overturned on appeal. You can appeal when it's denied. And actually, most of the time, you don't even notice it's happening. You go to a hospital, you go to the doctor, they do something, you pay your copay, they submit for the rest of the charge to your insurance company. Insurance company sends it back to them a month later saying denied. You know, it's supposed to be $2,000, $3,000, $4,000 for them, for their office, for their department, their hospital. Denied. Now they got to get up on the phone and say, hello, you know, Aetna, Blue Cross Blue Shield, you owe us $5,000. Why are you denying this? They'll say, well, you can go through the appeal process. So that's hours of paperwork and calling. And then a lot of times they grant, okay, here's your $5,000. Why would they do that? Because they know some doctors, some hospitals just aren't going to get around to it. Some of them will turn around and pass the $5,000 bill to the patients and say, hey, your insurance company's not paying, you better pay me. Somebody better pay me. I'm not going to work for free. But they know that, like, they'll still get a lot more money that way if they make sure to deny a lot. But this has real consequences, right? This is what insurance company denials look like. You get a bill from the hospital because your insurance company didn't pick it up. Just pay this amount here, $107,000.64. It's due 3/29/2019. You can use Visa, MasterCard, or Discover. We also take checks and cash. I'm not able to afford my insulin. I had a stroke. I need intensive rehab, but Aetna won't cover it. After the rehab, I could be good, but I'm going to have to go into $30,000 of debt to get rehab so that I can work, so that I can keep my insurance. Right? Somebody has to pay that $30,000. She's probably going to go bankrupt, right? This is not from 10 years ago. This is a tweet on April 17, 2019. She's somebody who's going through this right now as we speak. Like tens and hundreds of thousands of Americans right now as we speak. ER visits in some cases are the worst because everybody who goes to an ER has to be charged, has to be treated. ERs lose money all the time. My mom and my dad were in downtown Chicago. They live north of Chicago. They were in downtown on a Saturday night, and my mom has a heart condition, and she was feeling like she was having symptoms. So my dad, to be on the safe side, took her to the closest emergency room, which is, you know, downtown inner city Chicago on a Saturday night. Walk in, there's a big long line. You're waiting, and you finally get to see somebody, and they say, "Do you have insurance?" And they said, "Yes." And they said, "That's a no." Wait, what? You do? We got one. We don't have one.
Yeah.
The whole place is full of people without insurance. That's what they use for their care, right? So to make up that difference, they charge insurance companies outrageous amounts for things like, you know, a minor concussion, which you treat with an ice pack and some Advil. $7,000, $8,000 for an ice pack. Some insurance companies say, no, I'm not paying that. So then the ER sends it to the patients. This lady, this is one of the examples I'm talking about. It's a woman in Tennessee whose daughter hit her head on the table. She wasn't sure if she was having concussion symptoms or not. Took her to the ER outside Nashville. They said, we don't think she has a concussion, but here's an ice pack and some children's Advil. She should be fine. Watch for these symptoms. They give you a little handout, you know, the next 7 days, symptoms can occur. But then she gets a bill for $12,000. $12,000 for children's Advil and an ice pack, right? And what most people don't know is if you get this, you just call up the ER and say, I'm not paying this bill. And they'll say, okay, well, what about $1,000? You say, I'm not paying that either. They, how about $200? Or you get a lawyer. But a lot of people don't know that, and they know a lot of people don't know that. So they know a lot of people will sell their house and move into somebody's basement or something to pay that bill. And the you know, social media is full of thousands of these stories. Just let you read these for a second if you can. Can you guys see this?
Yeah.
I can read them out loud if you. Right, and if your relative goes to the hospital and doesn't make it, they send the relatives the bill. And the thing to remember is this happens to Republicans too. It's not like only Democrats get cancer. Talked to a guy who's running for state office down in Howell, Michigan, very Republican area. He's real conservative, fan of Trump. Who's that other guy who tried to run for the Republican nomination? Colbeck, yeah, big ally of Colbeck's. But we had a conversation about this, and he said, I would actually be, you know, I'm against all your other proposals, but I'd be open to single-payer health care if it's done right. Because my dad worked all his life, owned a small business. His business actually went under when he was 64 years old. So he figured, and he was able to buy himself health care through his business. But he figured, I got 18 months to go before I'm on Medicare. So, you know, to pay out of pocket at this point would be crazy. So he risked it. And unfortunately, he gambled and lost. He had a massive heart attack, you know, 6 months before getting on Medicare. They took him 17 hours of open heart surgery, and he didn't make it, and he died. And then on top of that, his grieving, whereas, you know, poor mom got a bill for $230,000 in the mail. That'll turn any Republican into a supporter of single payer. And the reason here that we got to talk about this, and this is where we get to the sticky part, right? That a lot of Democrats, if you watch the debates, they'll say, well, we can't outlaw private health insurance. But the problem is that the very business model of private health insurance doesn't work. Insurance works because you have a pool of people all pay in a little bit on the assumption that there's a chance that some of them might need to draw on the pool. Auto insurance, right? It's not the case that 90 or 95% of us are all going to get into a crash this year. Homeowners insurance. It's not the case that 90 or 95% of all the people who own homes are going to have them burned down or flooded or blown away by a tornado. That's why homeowners insurance works, right? Because only some people are going to need to use it. Almost everybody needs to go use healthcare. Everybody needs to go to the doctor at some point in their life. So essentially what we're doing is we're giving them our money and then we're giving it right back to them. They're a middleman that is unnecessary, right? The only way that they can make money is by denying payment, right? Because otherwise, if they actually paid out everything they were supposed to pay out, there's no way that they'd have money for all those slick commercials, for all those beautiful skyscrapers. Every city you go to, the tallest, most central skyscraper always has Blue Cross Blue Shield or Aetna on it. They're the #2 biggest lobby in Washington after Big Pharma. #2. More than oil and gas. And in these private health insurance, they spend 31% of the money that they get, that you give them, on things not related to healthcare, on administration, so executive salary, marketing, sales reps, sponsoring special nights at Comerica Park or whatever.
Lobbying.
You know, they just had this big lobbying event at a spa retreat in Virginia, outside DC, where they invited staffers of all these congressmen, including Dan Kildee, who's in the 5th District just south of here, to have, you know, mud baths and massages and, all the nice stuff while being treated to industry lobbyist PowerPoints on why Medicare for All is a terrible idea. When they go back to their bosses in Washington, nice and relaxed on their side. Medicare spends 2% of the money that it gets from taxpayers on administration, on the salaries of the people who run it. They don't advertise. They don't build giant, beautiful skyscrapers. And you can see where some of your money goes. United Health is the biggest one in the country. Their CEO gets $83 million a year. They are also, by far, as the average denial rate is 20%, their denial rate's over 50%. That's how they make their money. That's how they got to be so big. That's how he gets $83 million a year. Dan Lepp of Blue Cross Blue Shield Michigan gets $19 million a year. He's best friends with Governor Whitmer. He was a lobbyist. She was a DA. They both lived in Lansing. He got her into politics. He got her to run for state senate. He was friends with her father, who was the CEO of Blue Cross Blue Shield. He was one of the biggest fundraisers and supporters of her. He was on her transition team. When she became governor, he got a raise from $3 million to $19 million a year. You guys figure it out. And we'll talk about doctors maybe more in the Q&A, because there are some doctors that charge too much money. But the reality is, sometimes the doctors charge this much money because they're wasting so much money dealing with insurance companies. 1/3, on average, of all the money, the revenue that doctors make in their practices or as a group practice, they got to spend just on dealing with insurance companies. $80,000 a year per doctor. That's in terms of either time lost from seeing patients because you're on the phone with insurance companies, or it's paying, most likely it's paying all this office staff to do nothing but contest denials and argue on the phone with insurance companies and go through billing. This is what 30 million uninsured people look like. There are people, especially in inner cities and rural impoverished places, I'm sure you guys have seen some of this. This is in Appalachia. Once a year, this team of doctors, sponsored by Mountain Dew, ironically, come around and set up free dental, free vision, and free health clinics. And people camp out for days because their only chance to see a dentist. They know they got a cavity, but what are they going to do about it? They can't afford to go to a real dentist. Okay, so let's talk about this solution. We're going to talk about why Medicare for All is the solution to this. First of all, one of the most common misconceptions, and you'll see this online a lot, in the comment sections of articles, in Facebook discussions, is people say, well, I'm on Medicare. I don't know why everybody's saying Medicare for All. I hope you guys realize that, Medicare doesn't cover vision, it doesn't cover dental, it doesn't cover this, there's still co-pays and all this stuff. That's why it's technically called Improved and Expanded Medicare for All. That's the technical title of what is being proposed by people like Bernie Sanders and Pramila Jayapal and Debbie Dingell. And the reason is because, and so I'll talk about what it covers, but it's much more than Medicare is now. Okay, so you asked about, isn't there a bill? There's 3 bills. One is HR 1384. This used to be called 676 when John Conyers introduced it. But when he was out of the picture, Pramila Jayapal, who's the representative who represents Seattle, Washington, and who's a very strong progressive in the House, she took it upon herself to rewrite it. The original bill was like 3 pages long. It didn't really have anything in it. It was just a placeholder. She rewrote it, and it's like 120 pages long. So it's very detailed. She also kind of based it on the bill that was introduced the year before in 2017 by Bernie Sanders in the Senate, 1804. But in Lansing also, this is something that can be done at the state level, and we can talk about this more at the in question and answer, because it's a little bit less far along, though it has been introduced. Yusuf Rabi, the representative from Ann Arbor, who I think did make a trip up to the UP, he's very close with Sarah Cambensi, so he comes to like knock doors with her in the UP a lot. So he introduced 6285, which is called My Care, and would set up a single payer system in Michigan. So here's how it would work. First of all residents would be automatically enrolled. Even though we do have quote unquote single payer systems, meaning it's just one payer, just the government paying, like Medicaid or even Medicare. For Medicaid, as some of you may know, you gotta apply. You gotta go through an eligibility process. You mess up one piece of paperwork, you're out for that whole cycle, right? And a lot of times people get denials or rejections, I should say, even though they did everything right. Don't have to worry about any of that. Every American will get a card that says Medicare with their name on it, probably a chip or a magnetic stripe with all their information. It would be a crime to, fraudulently copy them or give them to somebody else, just like it is with a Social Security card. You just take it to the doctor or the hospital. Just keep it with you, like your driver's license, all the time. There would be no copays anymore, no premiums and no deductibles. You don't pay anything out of pocket at the point of service. You will pay more in taxes, but not at the point of service. There's no going to the ER, waiting for the attending to come, the anesthesiologist or whatever, and then having somebody from the administrative office come and say, your insurance has been denied. Do you have a credit card to pay for this? Because it'll be $1,000. That won't ever happen again. And then it's expanded Medicare, so it's like what Medicare covers now, but it will also cover vision, also cover dental, also cover hearing, and also cover long-term elder and disability care. So, and that's not just in a facility, that can also be at home. So if you have a relative who you're caring for at home, who's disabled, who's elderly, you will pay for caretakers to come and also pay for transportation. Medicaid does this a little bit now. A lot of times folks that live in rural areas or inner city areas, they might even have Medicaid. It doesn't do them any good if they're not of means to have transportation. They don't have their own car. They can't get to the doctor. It doesn't help them. So we'll cover all these things. It also institutes cost controls, right? Because part of the problem is that we spend so much on all these procedures that people don't spend that much in other countries. So part of this is also that we have to bring costs down to be in line with other countries. Now, Medicare reimburses doctors and hospitals at rates that are in line with Canada or Britain or Sweden. It's the private health insurance that reimburses at a much higher rate. So if, what Medicare reimburses for like $100, private health insurance, reimburses at $140, right? 40% more. So reimbursement would be at Medicare rates. And then, not in Bernie Sanders' bill, but in Pramila Jayapal's bill, the way that they will do it is, the way that they actually do it already in Maryland, it works very well. Something called global budgeting. That means that Medicare will go to a hospital, UP Health System or whatever, and say, your average costs over the last 4 years are $100 million. They would give you a budget of $120 million. And that's what you can reimburse up to. So if your thought is, oh, single payer is great, we'll bilk the government. If someone comes in for a broken toe, we'll bill the government $1 million. You could do that, but then you get to the end of the year in December and you've blown through your budget, and now you've got people doing open heart surgery. You're not going to get any reimbursement, right? And also, you can't build things like beautiful new waterfall or fountain or like the hospital that our third kid was born at in Kalamazoo, Bronson Hospital, where they had this beautiful atrium and like a bubbling waterfall and a grand piano, and a guy playing Chopin, and it's supposed to bring everybody's blood pressure down, but it also adds tens of thousands of dollars to the expense every day. Whereas the hospital in Germany was just a big box building and just a room, and you go in and you go to a room and the doctor takes care of you. There's no modern art. There's no, beautiful piano music. The other thing that this will do to bring costs down is that, as you know, right now, Medicare can't negotiate with pharmaceutical companies. They have to pay whatever price that they pay. This will let Medicare negotiate with teeth, meaning all these pharmaceutical companies are able to charge the outrageous amounts they are because they have patents. Patents are issued by the U.S. government. We are the U.S. government. We're the taxpayers. We're issuing these pharmaceutical companies the right to have these products, and then they're robbing us blind, coming back at us. So Jayapal's bill and Sanders' bill both say Medicare is going to go to Big Pharma, Eli Lilly or whatever, and say, we're not paying $700 a month for insulin. Insulin was invented in 1930. The inventor sold his patent for $1 because he wanted it to be free, because he knew how vital it would be for all the diabetic people. They changed one little molecule in the thing, barely, and then they say it's a totally new drug, even though their studies have shown at most it's moderately more effective, and some studies have shown it's not more effective than the original insulin that was invented in 1930. Should be free for everybody. $5 a month at most. Not $700, $800, $900 a month. So the government will be able to say, we're not paying that. We'll pay you $10 a month. And if you don't like it, we will take your patent away. And we will offer it to your competitor. And if we don't like what they say, they don't want to play ball, we will offer it as a generic. The Jayapal bill envisions a 2-year transition. First year is a buy-in. People can opt in and cancel their private health insurance. The second year, no private health insurance. I should back up a second. So both bills, and this is probably the most controversial thing, both bills say no duplication of service. No duplication of service means health insurance companies can still exist. They just can't compete with Medicare. Whatever Medicare doesn't cover, they can offer. I had some back problems 4 years ago. My Blue Cross plan was pretty good with the chiropractor visits, 12 a year, covered, no copays. It was very good. So, I actually only needed about 8 visits, and my back's been fine ever since. Really good chiropractor. But let's say that you just have a really bad back. The chiropractors have told you in the past, you're going to need to see a chiropractor every month, basically, for the rest of your life. And Medicare is offering you 6 visits a year. So you buy a supplemental plan. You buy a supplemental plan for that includes another 6 visits. That's how private insurance would work. But they can't compete with what Medicare is offering. So like cosmetic surgery, other things like additional things. So again, Jayapal says after year 2, so let's say we pass this in 2021, by 2023, that's all the private health insurance industry will shrink like this. To the size that it is in Canada, to the size that it is in Australia or Britain, where they still exist, but they're a very small part of the market. Sanders says it'll take 4 years to get there, so there's a longer transition period. Both of them have a plan for the 2 million or so people who work for private health insurance companies, okay, most of them will probably lose their jobs. First of all, a lot of them will be rehired by the federal government because it's the same skills. And you need people who know all the doctors and all the billing codes and all the software and all that stuff. So a lot of them are going to get jobs with just working for the federal government. But for Sanders, it's 2 years, or so for Jayapal, it's 2 years. For Sanders, it's 5 years. Or it might be reversed. I have to check on that. A salary replacement is the Jayapal's 5 years, and not just salary replacement. So they'll pay for you your salary that you had for 2 or 5 years. They'll also, or you can take that as job retraining, go back to college, go back to community college, or buy out early retirement. If you're like 62 and you work for Blue Cross Blue Shield and you lose your job, you basically just get to retire at 62 if you want. And then there's the question that people always say, oh yeah, well, how are you going to pay for it, right? And this is, in some ways, the easiest one to answer because we're the richest country in the history of the world. If we were Nepal, it might be difficult. They figured it out, right? Right now, as a country, total, we spend some say a little bit more than 3 trillion, we'll say approximately 3 trillion on healthcare. Okay, first of all, 60% is already what we call single payer. And I know this is, again, a lot of facts and figures, but the gist is going to be clear. About 1.88 trillion a year, Medicaid, Medicare, TRICARE, VA, Indian Health, CHIP, right? All those federal programs, we're already 60% of the way to a single payer country. 40% is the about 1.1 trillion, 1.12 trillion a year is what we pay to private health insurance companies. But the question is, how do we replace that? We cut that part out of the equation. Are we going to make up what 1.12 trillion a year, or they like to do this over 10 years because years fluctuate, so it's like a 10-year average. So they say 11 trillion over 10 years. And here's the kicker. None of that's new money. You will hear, and you can go to the talking points. This is one of the most important talking points that you're going to get. If you watch in the hearings on C-SPAN, the Republicans on the committees would say, this is $1 trillion a year in new taxes and new spending. And that's misleading. And you're going to see that on commercials. It is not new. It is not on top of what you're already spending. It's in place of what we're already spending. Oops, I'm missing a slide here. I'm going to, sorry, I'll go back. Sorry. Okay, we are already paying it. So the main thing is we are just proposing with Medicare for All to reroute the money that we're spending. Imagine all the money that's going into Aetna, Cigna, Blue Cross Blue Shield, United Health is like a big river of money, $1 trillion a year. It's a hell of a lot of money, right? Goes in, and then some of it sprinkles back down into the hospitals and the doctors and stuff. And then some of it stays up here with the CEOs. Now imagine taking that river of money and just joining it with the other river, the Medicaid and Medicare money. And it just goes through the federal government and back to the doctors and nurses. In other words, we're just rerouting the money. Instead of you paying that money to Blue Cross Blue Shield, you're paying it in taxes to the federal government. So how do we get to 11 trillion over 10 years? First, right off the bat, we're going to save $500 billion potentially a year just through efficiency and cost reduction, and not having all the offices arguing all the time over these bills, and not having the CEOs make $80 million a year. The administrator of Medicare will be the one in charge of the whole thing, or the Secretary of Health and Human Services, and they make something like $150,000 a year, right? Bernie Sanders has proposed, and so anytime, and we aren't taking an official position on the primary, but I will say that when people within the Democratic Party attack Bernie Sanders and say, yeah, he never says how he's going to pay for it, that's not true. There's a document on his website, Bernie Sanders, that you can click on that and it takes you right there, where he has proposed several options of how to pay for it. Normally in Washington, people don't include how it's paid for with the thing in the same bill. They pass a bill saying we should have a national park. Then the government figures out how to pay for it, okay? That's how it goes. Same with this. So he's proposed a 4.5% household premium for all households making above $29,000. So that'd be a tax, not per person, but per household, right? That will raise $3.5 trillion over 10 years. The average family making $50,000 or $55,000 a year will save money if they're getting rid of their premiums, okay, and their co-pays and deductibles, and replacing it with this tax. They will save an average of $4,000 a year. Everybody except the top 5% of wealth or earners in this country will save money. If you're more to the top of the spectrum, like I am, my wife also works at a university, so we do pretty well. We calculated this out, we'd be saving like a couple hundred a year. But we spend like $10,000, $12,000 out of pocket on health insurance on an average year. For the people who are self-employed or who are on Obamacare, you know, have a family plan, an average silver family plan in Michigan, it's $18,000 a year out of pocket. That's out of pocket. That's out of pocket. That's not the total cost of it. And so what a lot of Americans don't realize is when they're paying, you know, I pay like $10,000 a year. My employer pays another $14,000. It's really $24,000. That's how I get 12 chiropractic visits a year. It's an expensive plan. But that's $14,000 my employer is kicking in. All right. Then, and that brings up the issue of the employers. Then Sanders proposes a 7.5% income tax on businesses, on employers, after their first $2 million in earnings. So it exempts small businesses. If your small business makes under $2 million a year, you don't pay anything. There's literally no, because a lot of them don't pay for health benefits right now. This raises almost $4 trillion over 10 years, and it will save employers an estimated $9,000 per employee per year. There's no mechanism in these bills to mandate that those employers return that $9,000 to their workers in higher wages. This has always been the case with American workers since World War II, that we don't make as much as we could because we get compensated in terms of our employers paying for our benefits. If you take off the burden of the benefits from them, they should raise our pay. We should get more, and hopefully we will. Anybody who is unionized will be able to argue that. But there's other options for raising the money. There's a lot of tax loopholes. So employers get a tax break for giving their employees health insurance, right? They get to write that off their taxes. That's not necessary anymore. You close that loophole, and the federal government gets $4.2 trillion over 10 years. $400 billion a year. That's how much we give away as the federal government to employers so that they can give health care to their employees. So we're subsidizing it anyway. We can raise the top marginal tax rates to 52%. 52% over your $10 millionth in personal income. That will raise $1.8 trillion over 10 years. Remember, Alexandria Ocasio-Cortez came out on 60 Minutes and advocated for 70%, and everybody went completely batshit. And then they did quick polling and found out it was incredibly popular, even over 50% popular with Republicans. Sanders is only proposing 52%. If AOC were president, she'd say 70%. That might take care of all of it right there. We used to have 90% under Eisenhower of the top earners.
This is all going to be downloadable in PDF.
It's all there now on our website and on our Facebook page. I know it's a lot, but you got to have the information at your hand.
I just don't want to have to write it all.
No, please don't try to write it all down. We did it for you. He's also proposing a 1% wealth tax on wealth, not income, but wealth. So you own an island, you own a yacht, that counts as your wealth. 1% over 21 million. You wouldn't even notice it if you're that rich. That alone gets us 1.3 trillion. All of these things add up to more than we need. So you could do this and you could fix all the roads in the country or send everybody to college for free. So, talking point. People say we can't afford single-payer Medicare for all. The truth is we can't afford not to have it. We are wasting so much money in this country, okay, that by 2027, it's estimated that we'll be spending, remember we're around $3 trillion now? Try double that in 8 years. There are some people who are predicting, like the speaker that you had up, who works for PNHP, Physicians for National Health Plan, is predicting that by 2025, we won't even get to 2027. The whole system will collapse by 2025. It will just become so expensive, employers will just cancel their plans and people won't be able to buy it. So both personally and as a nation, this will save us money, right? And it will save us, the estimates are, over the next decade, if we were to adopt it in 2020, by 2030, it would save our country between 2 and 5 trillion. The 2 trillion is an estimate that came up inadvertently by a right-wing think tank that studied this crunched all the numbers in a hope to refute Medicare for all, and didn't realize that buried on page like 68 or whatever of the report, it showed this would save $2 trillion. The more left-wing think tank at Massachusetts, University of Massachusetts Amherst, calculated things a little more favorably and said it was $5 trillion. You could split the difference and say that this will save us $3.5 trillion over 10 years. That's enough to fix every road and bridge in this country. That's enough to send everybody to school, to college or trade school in this country for 40 years, for the next 40 years. Okay?
I can't read the source on that first point.
So on the first point, the right-wing think tank that came up with the $2 trillion is called Mercatus Institute.
Okay.
It's funded by not the Koch brothers, but the Mercer family. Or is it the Koch brothers? The Mercers.
I think Mercer.
The Mercers. They're big backers of Donald Trump, early backers of Donald Trump,
Mercer,
Cambridge
Rebecca.
Analytica. They're the ones that use all the Facebook stuff illegally. The other one there says PERI, the Political Economy Research Institute at UMass Amherst. It's more of a left wing. American Society of Civil Engineers says that would be enough to fix every road and bridge for a generation in this whole country, including in Michigan. So then the question comes up, and this is kind of getting to the last part of the talk. How are we going to get it passed? We talked to Debbie Stabenow on the phone. We're setting up a meeting with Gary Peters. We've met with Congress people like Dan Kildee and Alyssa Slotkin and Haley Stevens, who are Democrats, but they're not on board. And their question is always like, well, I'm with you, but how are we going to get it passed? My first answer I want to say is, I know you guys are the politicians. You're the ones that go to Washington. You figure it out. We're telling you what needs to be done. Your job is to figure out how to do it. But they won't do that. They want us to figure it out for them. So here's how we do it. First of all, we got to take the Senate and the White House in 2021, which I think we will. Secondly, even if we do that, there's no way that Democrats will have 60 seats in the Senate, which you need to break a filibuster. So you got to make a big move. And it's not just for Medicare for all, it's also for a Green New Deal. It's also for the climate crisis. It's also for, infrastructure. There's two things you can do. One, control the Senate, you get rid of the filibuster. You do that, someday Republicans might control the Senate, and then they'll be able to do whatever they want. But you decide it's worth it to keep our healthcare system from collapsing, to keep our climate from collapsing, you do it. Secondly, Sanders has actually said, so Elizabeth Warren has said that she would probably do that. She's not 100% sure, but she would probably do it. I think Kamala Harris has also said that she would, or she's very close to saying that she would. Sanders has said he would not. But Sanders has a different idea what he would do. There is a parliamentary procedure called reconciliation, right? This is partially how they got Obamacare passed. You don't need 60 votes for this. I won't go into all the details, but just be aware that what President Sanders would do is he would do this loophole whereby reconciliation is only supposed to be for budgetary things. But that's not anywhere in the Constitution. That's just a tradition that's been built up over decades and decades and decades. The Senate is all about its traditions. Most of what the Senate does is not in any document. It's not in the Constitution. They have a guy called the Senate parliamentarian. His job is to sit there in the back, and anytime there's a question about procedure, he gets out a big dusty book and a magnifying glass and says, aha, you can't do this. In 1829, Daniel Webster said you can't do this. The vice president is the president of the Senate. The vice president can overrule the parliamentarian. Let's say it's Sanders and Harris. Vice President Harris would say, you're overruled, and boom, Medicare for all. Some people would say that that would be like a coup of the White House taking over the Senate. But our Constitution puts the vice president in charge of the Senate for a reason. And up until now, they've only been figureheads. There's a reason why the vice president, who works with the president, is in charge of the Senate, and it's for this. So here are the presidential candidates who have co-sponsored Sanders' bill. Obviously, Sanders, Gillibrand helped write it. She's the one who wrote the part about the 4-year transition. Elizabeth Warren, Kamala Harris, and Cory Booker. Some of them have walked back the issue of private health insurance. Kamala Harris has said she wouldn't get rid of it, but that's a little weird because she co-sponsored a bill that says that it can't. It's incredibly popular. 85% of Democrats say they support Medicare for all. 70% of independents, even 52% of Republicans, 70% of the public. You won't get more agreement on something than that in this country. It's the people who control the political process that are against it. So here are some of the key talking points, and these are on the sheets that I handed out as well. First, if we pass this, single payer Medicare for all, not some of the other competing plans. Like I experienced in Germany, every provider is in network. Go anywhere. You're on vacation out of state, you're in Ohio, Wisconsin, you need to go to the ER, need to find a doctor, just go. It's the same everywhere. And that actually creates more freedom for you, not less, more freedom. One of the talking points against this is they say, you're going to take away health insurance, you're taking away Americans' choice. Americans like choice. Americans like freedom. But what do Americans like more? Freedom to choose their insurer or freedom to choose their doctor? You don't go to your insurer to have your back adjusted. You don't go to Blue Cross Blue Shield when your kid is running a really high fever. You go to your doctor. You should be able to go to any doctor, even one that's closer to your house, right? And it also means more competition. Ironically, more competition, more free market competition. Because if you're a doctor and you're in one plan, you know you kind of have a guaranteed stream of patients that are going to come to you. Because insurance companies like, well, you can't go to that chiropractor, you can't go to that chiropractor, but this is the one that's in our plan. So they kind of have no choice. They have to go to you. So you fix their back, you break their back, whatever, it doesn't matter. They got to keep coming back to you. Now you're in a pool competing against every other chiropractor in the country. All the chiropractors in Detroit suck. People are going to go to Toledo or Cleveland or whatever it takes to find good chiropractors because they can go anywhere they want. Unions, I'm in one. Every time our contract comes up for negotiation. Those of you who've been in unions, you know this too. It's your wages or your health care. Or maybe your working conditions. Those are the three things that are always on the table. And the minute they say, my union, the minute they say, well, we could give you 2.1% raise, but then we'd have to raise your premiums by, 40%. So what'll it be? Our union negotiators are always like, oh, no, we don't need raises. Don't raise our premiums. They scare you with the healthcare costs. Job lock is an actual term that researchers use. It means when you're working for a business or a company because of the benefits and you can't leave even though you hate it. Or even though you have an idea to start your own business or your own nonprofit. You got kids. One of them has special needs. You can't afford to be without healthcare. You can't afford to be without benefits, right? We know this because at age 65, there's a spike, a 14% spike in entrepreneurship in this country when people go on Medicare and they can start that flower studio or whatever they always wanted to do. A lot of women, we don't have very good statistics on this because of privacy issues and underreporting, but we know anecdotally that a lot of women who are in abusive relationships stay because if they were to leave, they would lose the benefits that they get through marriage for themselves and through their kids. And here's the real kicker. This is maybe a little bit different, maybe not so much with the new changes, the deal that Whitmer struck. But either way, a lot of our auto insurance bill is actually health insurance. Actual auto insurance to fix or replace a car is what, $20,000, $30,000? To fix somebody who's got traumatic brain injury and can't walk for the rest of their life is $30 million. Okay, that's like most of your auto insurance goes into that. This isn't like, these are estimates. The top estimate is upwards of a 60% reduction in your auto insurance bill. Because you don't need your auto insurance to pay for, if you run somebody over or somebody runs you over, you don't need the auto insurance to pay for your hospital. And frankly, almost all other forms of insurance that have general liability in them, homeowners, business, insurance, all that stuff's in there. The potential future healthcare costs of somebody who slips on your sidewalk and sues you for $1 million is baked into all those insurance bills. All of those will go down. Even malpractice insurance, even workers' comp will go down. And don't like ambulance shit. These are talking points for Republicans, guys. They hate the lawyers, the tort lawyers or the Trial Lawyers Association. They're always trying to get tort reform. Here's your tort reform. Single payer. All those ambulance chasing ads you see on TV, they'll be gone. There'll be no need to sue any insurance companies or any businesses anymore because, again, you slip on somebody's store, sidewalk or whatever, you'll be taken care of. And since I work at a university, I can tell you, our tuition costs from our students keep going up and up and up, and I feel terrible about it. I assign less homework. I give kids extensions and extensions on extensions because I know they're working 2 and 3 jobs to pay for college. And I'm not about to be up, in that classroom and say, well, I don't give a crap, you shouldn't be working so many jobs. I know how expensive the tuition is. Part of it's because of the cutbacks from the state. That's part of it. But part of it is also me, my health insurance. That $14,000 a year that Western Michigan kicks in for me and my family, they don't eat that. They pass that along to all the kids and their parents who go to college there. That million people who go bankrupt every year because of this, your credit card rates are high, auto loan rates are high. Part of that is they're covering their losses on the million people who go bankrupt and max out their credit cards to pay for their medical bills and then go to court and say I'm not paying this back. And even prices, it's estimated that $1,400 of every car built in America is the health insurance that we're paying to the auto workers. Since Japan and Korea and Germany all have some form of single payer, especially the Japanese and the Koreans, that's one reason they're able to sell cars for about $1,000 or $2,000, $3,000 cheaper. I just went car shopping recently, and it's just amazing. American cars are fine, but they're all about $2,000 more expensive than the Kias and the Toyotas, right? Because those companies don't have to pay for their workers' health care. And it also makes us uncompetitive, too, internationally. If you're a multinational corporation looking to locate, and all other things being equal between Canada and the United States, or Germany and the United States, or Britain and the United States, you go to one of those other countries, because at least you don't have to fork over millions of dollars in healthcare costs. And this is something we hear from doctors. People will say, well, the doctors will fight this. Some of them will. The really high-earning ones will. The specialists will. But for most of them, they are on the verge of quitting right now because they got into medicine to help people, not to fight with insurance companies. The average American changes jobs something like 20 times or 30 times, changes careers 5 times, right? Every time you do this, or every time there's a downturn in the market, in other countries, people lose their jobs. That's traumatic. You're used to doing a routine every day. That's where you get your self-esteem from. It's terrible to lose your job. If you've ever been laid off or fired or had a company you work for go under, it's not nice. But in this country, it's life or death. You lose your job, your company goes down the tubes because of a downturn in the market, and you can't pay for your insulin anymore. In Germany, you lose your job, it sucks, but at least you can still be alive. So I just want to end by talking about some of these, because you're going to hear this now, the more and more we get these primary debates going with the Democrats, right? And it's good. This is what we wanted. Our groups like ours have been pushing and pushing and pushing what they call the Overton window. That's like what the scope of what everybody's talking about. You got to push it onto your ground. If people are arguing between we should have the free market or Obamacare, we're losing. If we're having an argument between single payer Medicare for all and something kind of like it, we're winning, right? But you're going to see that now. They're going to see other candidates like Pete Buttigieg or some of the more moderate ones like John Hickenlooper. I'm trying to think of the other ones. They're Beto O'Rourke. They're proposing things that go short of full single payer Medicare for all. So let's look at Debbie Stabenow. She's proposed Medicare buy-in at 50. And again, that would mean you could buy in at an affordable rate, and you could leave your private insurance plan at age 50. It's almost certain that this would help to lower the premiums a little bit for all the rest of us, because people over 50 are the most expensive. They use up the most resources just because of human nature. The problem is you have all these millennials and even the generation younger than millennials, the Gen Zers who are in their 20s, graduating from college now.
Young families.
Young families. So somebody's 28, they have kids, the kid has special needs. Like, what are they supposed to do, right? Not only that, but more and more of these young people, if you know them, you've got grandkids or nephews or whatever, there just isn't that career track, full-time job at a big company. It's not as common anymore. It's what they call the gig economy. They work 30 hours at Jimmy John's and drive Uber for 20 hours a week, and then they do some online consulting for another 20 hours a week and patch it all together. None of those jobs have health benefits. You can patch together $50, $60, $70,000 a year doing that, working hard and hustling and putting together different jobs. Yes, you can, but you don't get the benefits. You don't get the healthcare benefits. Medicare buy-in public option would be for everybody. So Pete Buttigieg is one of the people who supports this. There are many others. So this would be everybody could buy into Medicare, even those who are 20s, 30s years old. And what people like Buttigieg says is that will lower prices for the rest of us who are on the private insurance through our employers, because it'll be a competition. More and more people. He says if Medicare is so great, let's prove it in the marketplace. People will leave the private insurance plans and they'll all migrate over to Medicare, and private insurance companies will have to lower their rates to be competitive. The problem here that some politicians like him, I think personally, and again, organization's not endorsing anybody, but the problem with this is that, as you saw, half of Americans can't afford to buy into anything. If you say, well, you don't have insurance now, but you could buy into Medicare for $1,000 a month, or $500 a month, I'd be like, well, I still can't afford that. Like, I'm not going to buy into that. And so what will create, and the argument against a public option is that it will create a two-tier system. A little bit like we have in some places with the public school system and then private schools, right? All the problem kids, all the kids with special needs, they get dumped into the public school system that then is starved of the resources to handle them. So the quality of education for everybody goes down. None of the teachers want to work there, and the people who can pay send their kids to expensive private schools. This will be the same thing. The people who can pay will buy expensive private health insurance plans that will entitle them to the best doctors. The best doctors will only accept the private insurance plans. Everybody else gets Medicare. Medicare gets a stigma. It's like, oh, you're on Medicare? Oh, you must be poor, right? Kind of like we have with Medicaid right now. Another and more interesting and I think more palatable plan was introduced by Congresswoman Jan Schakowsky and Rose DeLauro, called Medicare for America. It was originally designed by a think tank called the Center for American Progress in Washington, which was sort of seen as the really close policy ally of Hillary Clinton. The leader of it, this woman named Neera Tanden, was widely thought to be in line to be President Hillary Clinton's chief of staff. And so when she didn't win, it was sort of like, what happened? And some people see what they're doing here is trying to undercut Bernie Sanders to get revenge for 2016. I think there's some people, that's true. I think there's some people working there who are more serious about policy than that. This is a plan that is supposed to be that has been introduced as well as law. And here's how it works. It doesn't ban private health insurance. So it doesn't cancel your employer's plan, cancel your plan, and put you onto Medicare. But it gives you the choice to buy in with deductibles capped at $350 a year, right? Which is specifically designed for those people who don't have who have less than $400 in the bank. No deductibles, zero deductibles under 200% of federal poverty level, which is something like $40,000 a year for a family. premiums capped at $5,000 a year, but it's graduated by income. So again, you're under 200% of federal poverty level, your family bringing in $40,000 a year, you pay nothing for your health insurance. All newborns will automatically be enrolled. So as the decades go on, every American will eventually be enrolled. The con here is, again, a two-tiered system. And the other thing too, and this is kind of, we're getting to the very end, but I want to just point this out. You'll hear a lot of the more moderate Democrats say we should keep private health insurance because we got to give people a choice, right? If you should be able to choose whether to keep your private health insurance, right? The problem is most Americans get their health insurance from their employers. They don't actually choose. Their employers choose. Employers choose their plan for them. Their employers choose whether to carry it at all. Now, there are some people who are in a very enviable position. They're incredibly talented, skilled people who can actually choose their job based on who has the best health plan. That's like 1% of Americans. Most of us get a job through many, different circumstances. We get one, and we're thankful if it comes with benefits at all. Our employer is the one that chooses. And what will probably happen in this situation is that a lot of employers will say, oh, I'm just going to cancel the plan because I can just move all my employees over to Medicare. So it's misleading to say you get to keep your insurance if you choose. So I'll just leave it here. Adi Barkan, maybe you've heard of him. He's a healthcare and single-payer activist. He's suffering from ALS, Lou Gehrig's disease. When he started fighting against Trump Care a year and a half ago, he was out protesting and giving interviews. His disease has progressed now to the point where he can't talk or really move. He can only move his eyes. And so, like with Stephen Hawking, he just communicates through a computer. And he testified in April using his computer-generated voice in Congress. And he made it clear, if we keep the for-profit health insurance system, some people will still be left out. So I'm going to end things there. Thanks for your attention. I know that's a ton of information that I just threw at you, okay? But this is kind of the whole picture, the whole shebang. We have a shorter, like 10 to 15-minute presentation if you want to, get more of a summary from it on our webpage.
This is the best I've seen. It's great.
Thank you. But we're open to questions, and Paul knows a lot about stuff as well. We talk about, the latest research and stuff often. So, yeah, thanks for listening. Yeah, thank you. Yeah, so any questions that you have, any thoughts?
I have
Reactions.
one thought.
Yeah.
I have brought this up before. If we had a government paying for the health care of its citizens, would that make the government more responsive to those situations where we have industries polluting air, contaminating water? Because those create health effects, bad health effects. And if the government is paying now for these consequences, is it arguably something that the government would start to enforce more strongly, our pollution laws and environmental protection laws, that sort of thing?
Yeah, you guys understand the question? I mean, it's like, this is one of the things that affects people the most is, cancer. I mean, there's parts of Michigan where the PFAS levels are really high and the cancer rates all around are really high. There's the Marathon Refinery in Detroit. All the people around there have incredibly high levels of cancer. It's not a coincidence. And somebody's got to pay for those cancer treatments. In fact, there's a funny thing. There is one town in America that has single-payer Medicare for all. It's in Montana. And John Tester, I think was the guy. Max Baucus, sorry. Max Baucus, the senator from Montana at the time they were negotiating Obamacare, held out his vote. He was one of the Democrats who was holding out his vote. And he knew there was a town in which people had been poisoned by a mine of some kind and had astronomical rates of cancer. And so to buy his vote, Obamacare contains a page in the law that guarantees just the residents of this one town in Montana free Medicare for life. That's the kind of thing you're talking about, yeah. And that's what got Max Baucus to vote for Obamacare, yeah.
That happens here in Michigan too. There's a lot of people that live near Dow Chemical that come up with rare cancers never seen unless you lived in a certain area around a chemical plant near Standifer or something like that. And, you know, that first thing the doctors will ask is, where do you live at? And they exactly know that exactly what that cancer, how that originated because of the area they live in.
Yes, this is intersectional, yeah.
When I lived in Wyoming, there was the area I lived had the highest breast cancer rate any place in the United States. So, I mean, it's just, why? I would be curious as to the cancer rate in the United States versus some of the other countries.
Yeah.
And it just seems like in our country, there's such a history of not holding industry accountable. When there are these obvious things happening, and deaths are happening, and sick children, and high rates of asthma, you know, and things like that. And you know, that it seems to me like if we had it where our government was starting to pay for some of these things, it would be a lot more responsive than what
We
it
are the
is.
government.
No, that's right.
We are the
That's the key thing to remember. We are the government.
But
We
if
pay
we
for
didn't have, we had single payer, we didn't have the insurance companies buying the politicians, then
So-
perhaps would have more say over who gets elected.
So to me, this is another one of the talking points. You see on the debates coming up at the end of this month, you'll see the same thing come up, and the moderates, like Buttigieg, they'll say, like, well, you know, we can't, you know, can't just get rid of an industry. And my feeling is, it sounds harsh, but it's better to give them a quick death and get it over with. The more you leave them around, the more they're going to pay lobbyists to undermine the system. There's no country that has adopted a single payer system that's ever voluntarily given it up. I can tell you that in Canada, the insurance companies are much smaller, but they still exist, and they still fund politicians from time to time, like the guys, the mayor of Toronto, I think, who are trying to privatize everything.
Now, can I get a clarification, because we're talking about Indian health insurance and VA, True Care or TRICARE, you said. And now, as I understood it, unless something's changed, VA was not going to be affected by the Medicare for All or the Indian Health.
Indian Health is not affected. It was originally, and then they decided, Jayapal and Sanders decided to leave it out outside the system. So if you're in the VA or if you're in Indian Health, you would just keep that as your health insurance.
And then the TRICARE, what would happen there? Would that be absorbed into the new Medicare
As far as
system?
I know, the TRICARE would be absorbed. Yes. Okay. I think I need to double check that, actually.
Yeah.
I just don't remember seeing it mentioned in the legislation, so my assumption is everything that's not mentioned as an exemption is wrapped into the new Medicare.
Yeah.
TRICARE, if you guys don't know, that's for active military and National Guard and their families. Yeah.
It seems like the most effective way to advocate for anything is to reduce everything to single one-liners, right?
Yeah.
Your presentation has given me quite a few one-liners.
Oh, good.
Actually, yeah, that would be very effective, including the fact that the biggest supporters of Trump found that there would be this incredible reduction in the cost of healthcare.
Yep.
So, but there are quite a few of them. So instead of trying to present a lot of facts, we need to reduce everything, reduce the best of what you've got to what is going to work in single line talking points.
Actually, just that you mentioned, we have these postcards that have like sort of single
Talking
line
points.
talking points.
Yay.
10 different
There you go.
reasons. Give you guys some. Just take them with you. Write them to politicians. Hold a postcard writing party. Take them.
Okay.
Take them.
Good.
Here, I'll give Paul some too.
Yeah.
And there's more if you need. We can just send them up to you.
Okay, good.
Yeah, these we find you can write with the address of the politician on the side and send it off with a postcard stamp, or you can use the whole back of it to write a more personalized message, and then you can either put them all in one big bubble envelope and send them to the politician, or if you think what the most effective thing to do is to find an event where that politician is holding and go up to them and do that. We did this most recently with Alyssa Slotkin. We had an organizer she was in, I forget where it was, East Lansing or something, and she came up to her after to take a selfie. There's always a selfie line after. If you don't get a chance to ask a question, you can still go after their talk or their town hall, and you can say, I want to take a selfie, and while I'm at it, these are postcards that we wrote in Chippewa County. We would like to give them to you. These are voices of people who need single payer. And if you film it and put it on social media, then it doubles or triples the impact, because now they know everybody saw them getting it. And so Alyssa Slotkin knew she was being filmed, and she promised to read every single one of them and take them seriously. It helps. Yeah.
We also have a lot of businesses in our area, small businesses. And it seems to me like this would be something they would be interested in, because a lot of small businesses up here can't afford health care insurance for employees,
Right.
for workers. So they're at a loss. They can't compete for workers. They lose them to workers that can provide health insurance. So is there somebody that we can approach that would be able to talk to small businesses in their language and convince them that this is something they should be considering?
That's a good question. I don't know of a specific person. I know that I've talked to people who are business owners, though, who agree with this. Especially when you point out that we're talking about under $2 million a year, they'd be paying nothing. Yeah. I mean, I would just, go through who you know. Start there. Invite somebody to coffee and tell them that you're part of this new movement and this new group, and you'd like it if they could write a letter. Because and you pass that along, you send that along to Debbie Stabenow and Gary Peters, or you send it along to even Gretchen Whitmer.
Because if we could muster up people in the business community, get their support, I think it would have a big impact.
Yeah, it would.
A lot of businesses too would probably appreciate that they have more healthy workers showing up.
Yep.
And people that are half sick standing there in the food line, handing out food.
No, this is the eternal struggle for restaurant owners.
Yeah, exactly.
Whether to send an employee home because they're always sick, and, they can't go to the doctor because you don't give them any health benefits, because the turnover and the margin rates in restaurants are razor thin.
Instead of 1 day, they're out 5 days.
Well, I used to work for I was with an AT&T retiree, and I had excellent healthcare benefits through AT&T. And that carried me through even afterward when I went to work for this small business. And I did 6 years as a radio technician, ambulance radios.
Right.
But anyways, he had health insurance for his employees. He did everything he could to keep that insurance going, but the cost just got up and up and up, till finally he had to give it up. And he did not like it. He did not like giving that up, but he was forced to.
Mm-hmm.
So I'm sure there's going to be a lot of people in business that are in that situation that would love to have something like this, single payer health care for all, so that they don't have to worry about it.
Now, I'd love to see the same presentation offered in like local libraries or something.
Yeah.
So some of these folks are great speakers. I wonder if anyone would be willing to do that eventually, whether it be in Emmett County or
It's
Sheboygan.
open to anybody, and I'm happy to do, if people want to do like a Skype training session or something to kind of go over points and brush up on things. You don't need to be an expert, but you need to get out there. As only one person can only go to so many places, and the more that this is free and open to anybody to download, make copies, pass it along.
Well, we have one doctor that's part of our group now, and I think he would be interested in speaking
No, that's a
publicly.
great idea.
And that way we have somebody local that can go and talk at the libraries, like you mentioned,
Yeah.
or in the other locations. So we're trying to work on that. So and if you
We
know
gotta
of
get-
anybody else that's
Yeah.
interested, let
We
us
gotta
know.
get more people seeing that. Who put this together?
So I put it together with help from some other activists who are on our board who have been doing this work for years and years and years. A guy who started the organization in Ohio, based in Toledo, and then a woman named Margie Mitchell who has been advocating almost alone at sometimes for single payer since 1990 in Michigan. And she
You
knows
guys did a
everything.
great job.
She knows
I
everything.
can't
there
wait
is.
to go home and go through it and write that one-liner. There's a lot of good one-liners in there.
And you can be reached through the website.
Through the website, the email address that's on the handouts, and in some ways the Facebook page is easier. It's more just it's the way things are now. Social media is just more active.
Carolyn,
If you-
I can email the whole presentation to you, the slideshow. I can email that to you. I've got
Oh,
that.
you
email
were
it.
saying you can just download it,
You
right?
can download it. I can send you the link to download it, whatever you like.
Perfect. So I think the more
Mr.
we
Right.
One for college students, because they always have insurance of that dark time when they use it. They
Mm-hmm.
leave their mom's house and they go to their parents' house and go to college. A lot of students lose insurance.
Yeah, that's right.
And just one other question about Debbie Stavenos and if people opted to purchase into Medicare at age 50 and over, do you see that as a good transition time, or are you
Yeah,
saying
so
that-
okay, so that's a great question because like a lot of times what people like Stabenow will say is like, look, I'm for universal health care too. It's not that I'm not, right? It's just that unlike Bernie Sanders, I'm the grown up in the room here. I'm being realistic about what we can accomplish right now. So we could get a buy-in at 50 done right now, and then we extend it, down the road.
lowering the age?
My response to that, and I told her this, was that's great. I'm glad to hear, and I understand your point. But first of all, with Mitch McConnell in the Senate and Trump in the White House, nothing is possible right now.
Right.
You could propose, a cure for cancer, and McConnell would stop it just because he doesn't want to give Democrats any credit. So it's like we either win the Senate and the White House in 2021, or none of this stuff matters.
Right.
Not Stabenow's plan, not this, not Sanders, not the other plans. None of it matters. So if that's the case, why don't we just push for what we really want? Why don't we just go all the way? See, if you push for what you want, you might get 3/4 of what you want, right? You push for complete single-payer Medicare for all. Maybe it comes down to some tough negotiations with the most conservative Democrats, like the one in West Virginia. Maybe we don't get 100%. Maybe we end up with a 90% single-payer system, which is what Germany has, which I lived in, which was perfectly fine too. I mean, for me, it was my family. But this attitude that I feel like a lot of Democrats have of, well, it's not realistic, so let's not ask for it. Let's aim low.
Yeah.
Then you end up way down here. That's my feeling.
Anytime they have to go
Right. Right. Or they can just write a check for any kind of emergency that comes up. It really, most of these people now and probably never in their lives have been in a situation where you get a bill in the mail that you just can't pay. And you just don't know what you're going to do. And that's something that, easily half of Americans have that's their life. That happens to
That
them.
was me last year.
Yeah.
$800 physical therapy bill when I fell.
And you don't have it. So what are you going to do? Yeah. Sell something? Take on extra shifts and you're already maxed out at work? Like, that's the real life in America. And most of these people, that includes, Debbie Dingle likes to tell this story when she talks that, she had a really great job at Ford for a long time, and so she met John Dingle, and then she got married, so she was a congressman's wife, and then she became a congresswoman. And when he was really sick and he was dying, she wanted to find out what it would be like if she didn't tell anybody who she was. She just said her name was Debbie, and with like his insurance company, and it was horrible. And then she likes to say, you know, then I called my congresswoman, which is her. And then she got on the phone and said, this is Congresswoman Daigle. You know, I want to talk to somebody in charge. And of course, she took care of everything right away, and it all got fixed. When she does that sometimes, she'll pretend not to be herself to find out what it's actually like when you're not a famous politician. So we need to wrap up.
But thank you so much.
Yes,
for
no,
doing
thank
this,
you all for coming. Yes,
And it was valuable getting this
Yeah,
recording.
thank you.
Thank you
so
very
much.
much.
Thank you.
Anybody want the picnic? I have a question.
Yes,
I see that these cards are like reason one, reason.
I don't have all the reasons.
Okay, how do we get those?
I can send them to you. They're also on the website and not on the Facebook
I
page. I
love
could
these
put them.
cards because
You can take
Yeah.
the template. I can also just email it to you. Paul has it, and you just take it to a local printer. I can
okay,
just print it out for you.
okay. Oh, could we use one of those printers?
Yeah.
Like online printers?
I don't know. I've never used one before. We just
Yeah.
use a local UPS store that's
Okay,
in town,
yeah,
and
but right, well, it should work.
yeah.
Okay, so let me give you my email.
Yes, that'd be great.
So you went to the picnic after?
No, we got to get back down to Ann Arbor.
Oh, okay.
Yeah, I got family members. We're here.
I
We
didn't get a
were
flyer.
on vacation too, and we were in the UP in El Paso. And come and give a talk in Mackinaw.
There you go.
Yeah.
Yeah, we were at the powwow yesterday up in Sioux.
Yeah, cool.
That was fun.